what does the impact of sound money have on my work professional life? It's pretty clear, I think, if you ask any doctor or any observer, that there is a problem with healthcare funding that seems to be systemic and seems to be getting worse all the time in places that we live in and we work in. And I think the underlying reason for that is an issue with how the money system works and how it's distributed. In particular, with regards to how inflation in the price of healthcare seems to be outpacing the increases in funding that are delivered to healthcare by most governments, particularly in the Western world. And since we last spoke, I've developed some of those ideas a lot further. I remember in the last podcast we did, you sort of asked me, how is Bitcoin supposed to fix healthcare? I really didn't have an answer for that, and I hadn't sort of thought that through very well. But as we've began to understand Bitcoin more and the issues affecting the healthcare system more, it becomes clearer that the two are related in more ways than one.
The cost of supplying health services is going up faster than the funding that's arriving. How does that actually play out in reality?
Bed pressures mainly, which mean that we don't have enough beds to treat the patients that we need to treat. And that's sort of the most important element. And that factors into every other aspect. So, for example, you might hear about ambulance ramping, where ambulances are parked outside the hospital. The reason for that is not that there's not enough ambulances. The reason is there's not enough beds in the hospital to put patients in. And so because the hospital's full and the emergency departments are full because the patients being seen in the emergency departments can't be transferred to beds on the ward, the ambulance has nowhere to put the patients that are arriving, the new patients. And so they have to wait outside, because the safest place for a sick patient, if you don't have a bed in the hospital, is physically in the ambulance waiting to get in. So the ambulances just ramp up outside. So that's one example. The other example is, surgical waiting lists blow out. Again, similar reasons. So where I work, we have a big problem where we have enough surgeons. We have enough physical theaters to do the operations in. We just don't have the resourcing in terms of other staff and in terms of beds to put the patients in when we're done with the surgery. So operations get canceled on a regular basis because there are no beds to put the patients in after the surgery. And so the analogy I sometimes give people is, everyone's quite familiar with the housing crisis where, is the connection okay on your end?
I can hear you, so it's okay. We'll be able to patch it together, don't worry.
Okay. So one analogy I give is with the housing crisis, which everyone seems to understand pretty well. It's a similar issue, except healthcare prices go up even faster than housing prices because it's a harder asset, it's a scarcer asset. It's more difficult to make a hospital bed than it is to make a motel bed or an apartment bed. And so it stands to reason that whatever problems you get in the housing market, you get a magnified problem in the healthcare market by the same rationale.
Wow.